Kia ora ana tātou katoa. My name is Dr. Donna Mokoroa. I am a medical officer and pediatric registrar for the Ministry of Health. The outpatient and emergency department has relocated from Rarotonga Hospital to Tupapa. The reason why we had relocated to Tupapa outpatient is to decentralize our health services to protect our hospital patients who are high risk, and to have a designated isolation ward for our COVID-19 cases, as well as to strengthen our emergency and primary care services in the community. The specialized clinics we provide at Rarotonga Hospital include medical, surgical, pediatrics, and obstetrics and gynecology clinics by appointment only, and also our antenatal clinics for our women. We also provide radiology services as well as our laboratory services. Please avoid going to Rarotonga Hospital unless advised by your doctor. The services that are available at Tupapa Community Clinic include telephone consultations as well as doctor's consultations by appointments. We also provide emergency services for cases such as chest pain or shortness of breath. We have on-site pharmacy dispensing of medications, and we have established our eyes and ear clinic for our patients. We have established community health clinics in each Puna to decentralize our health services to support infection control and prevention processes, as well as to move health services closer to people. The health services we provide in these clinics include nursing care, such as first point of care for families, baby checks, doctor's consultations on certain days, medications refill, blood tests, health checks for all NCD patients, and dressings. The telephone consultations as well as the community health clinics in your Puna are free. The community health clinics opens from Monday to Thursday from 7 a.m. to 3 p.m. On Friday, they open from 7 a.m. to 12 midday.